Hi, Grandma. I see you have questions for me about pneumonia and its causal agents, and I'll be happy to answer your questions. So, what is pneumonia? Pneumonia is an acute lower respiratory tract infection, and it is caused by viruses and bacteria. So, example of bacteria that causes pneumonia include the Streptococcus pneumonia bacteria, as well as the Haemophilus influenza type B bacteria. And viruses that causes pneumonia include the respiratory syncytial virus, as well as um, the influenza virus. So, what are the symptoms of pneumonia? Symptoms of pneumonia include coughing with a production of phlegm, chest pain, body aches and pain, chills and rigor, as well as a fever. And one other important symptom is the bluish discoloration of the extremities, which is called cyanosis. This is due to lack of oxygen in the peripheral bloodstream, and so the person who has pneumonia does not take in enough oxygen due to compromise of the lung function. And so I will talk a little bit about the most common cause of pneumonia, which is the Streptococcus pneumoniae bacteria. And it is a gram-positive bacteria which has a single lipid bilayer. And it is also an encapsulated bacteria, which helps to determine its virulence as well as serves as a target for vaccines, which leads me to the next topic, vaccines. There are two types of pneumococcal vaccines, which are the pneumococcal conjugate vaccine, which is used to prevent invasive pneumonia amongst very young children and infants. And also there is the pneumococcal polysaccharide vaccine. And so, usually when a child is born, they have lined up vaccines for the child, and the pneumococcal vaccine is usually administered at the age of 6 weeks. And usually, a child gets two primary vaccines and a booster. So, it is recommended that these are spaced by 8 weeks. So I'm going to talk a little bit about how pneumonia is diagnosed. Pneumonia is usually diagnosed by a physician, and this is done first with clinical examination, which involves listening to the chest and the heart rate. And so the heart rate is usually increased in a patient who has pneumonia, and also you hear rills and crackles, which are sounds in the base of the lungs to show that there is an infection or some sort of fluid in the lungs. So I have pictures of X-rays right here. This is a picture of bronchial pneumonia, which is very common amongst very young children and the elderly. And this is a picture of a lobar pneumonia, which is a collapse of a whole lobe of the lungs. And this is common in young adults. So I'm going to talk a little bit about how pneumonia is treated. Pneumonia is usually treated with antibiotics, and one of the mechanisms antibiotics used to treat pneumonia involves recombination, which is usually when the bacteria begins to pick genetic material from its environment and incorporates it in its own DNA. And so the DNA breaks down and the bacteria dies. So we have antibiotics like fluoroquinolones and vancomycin and first generation antibiotics. These are antibiotics used to treat pneumonia. Well, I hope I've been able to answer most of your questions, Grandma. Let me know if you have more, and you have a wonderful evening. Bye for now.